With Australia's first shipment of the Pfizer vaccine now in the country, the Territory's planning to roll out its first jabs to a select group from next week.
We are starting small, but the most important thing is that we are starting.
So please be patient. There's only going to be a small number of vaccines available, as the Chief Minister described.
The first phase, labelled 1A, will cover quarantine and border control workers, including police and airport arrival staff, aged care residents and staff, disability care residents and staff, high-risk hospital and healthcare workers.
Most of us won't get the vaccine until the second half of the year, and that's okay. It's not something to worry about. Other countries have to rush their vaccine rollout because they have no alternative.
Around 4,000 doses will be given to the NT. They'll be used to vaccinate an initial 3,000 quarantine and border control workers and the high-risk health staff.
High-risk healthcare workers include staff working in emergency departments, respiratory wards and clinics, and intensive care units across the Territory, ambulance workers, care flight and Royal Flying Doctor Service staff, and staff in COVID-19 testing clinics.
The Territory's also getting some help with the job. The federal government will take on the task of vaccinating about 1,500 of the NT's disability and aged care residents and staff.
There are a lot of questions that remain unanswered, and of course people don't know how they're going to access the vaccine and when they're going to be able to access the vaccine. Royal
Darwin Hospital will become the first vaccine hub, and the Alice Springs Hospital will follow in the next few weeks. There's no start date for the second phase of jabs, but March has been pencilled in. It should cover the rest of the healthcare workforce, police, fire and emergency services workers, Aboriginal residents over 55, older Territorians over 70, young people with underlying conditions and meat processing workers.
One needle at the very beginning and another needle in a few weeks.
Despite the government's latest messaging, there's still no clarity about whether the two-jab Pfizer vaccine, which requires storage of minus 70 degrees, will be an option for people living remotely, or if another type will be used.
We are waiting for some more information from the manufacturer and from the Commonwealth about safe transport of the Pfizer vaccine.
The Territory's first vaccination phase is expected to take about 4 weeks. Felicity James, ABC News.